Hi everyone, welcome back to our channel Life as an Expat. Alright, so today let's talk about how medical system works in Canada, how you can enroll for it once you are new to Canada, what are the challenges which you may face and what all is covered in that. So without further delay, let's get started. Seen in our one of the video which all things you need to do once you land in Canada after getting your PR, what are the initial formalities. Once you have completed those formalities and you are free now to enroll for a doctor, what you can do is near to your rented place you can search for the family doctor clinic. You can call one of the family doctor clinic and ask them to book an initial appointment. During the initial appointment, doctor will assess your health and they will give you few of the general blood tests so that they can check whether you are physically fit or not. And once that is done, that will be the family doctor for you. Every time you have any issue, you need to call that clinic and book an appointment with the family doctor. If you have a general problem also like fever, cough, cold or any normal issues, then you need to go to family doctor. In case of any other problem as well, first you need to go to a family doctor. That doctor will refer you to the specialist. I personally do not like that we have to go to the family doctor every time we have any issue, even if the family doctor is not expert in that area. What will happen is family doctor will refer you to the specialist, and normally you do not get specialist's appointment within the same month. So if you have any severe problem, you have to go to the emergency. Emergency means in the hospital near to your place, there will be emergency department separately. You can go there directly. There will be long queues of course because they will treat the critical patients first. In emergency, they treat the severe cases first, like pneumonia, heart problems, accidents. If you had a small fracture, then you may have to wait in the queue for a long time, but there is no option. That is because medical is free here. Those all things will be covered in your health program. Most of the things are covered in your health program apart from dental and few of the scans and blood tests. Like liver scan and vitamin D blood tests are not covered. If you have to take ambulance in any critical situation, you have to pay for that from your pocket unless it is covered in your private insurance. Private insurance is something which is provided from your company where you work. It depends on your company how much coverage they are providing. Sometimes some of the insurance companies provide 80% coverage and some provide 100% coverage. Depending upon that, many of the services which are not covered in government facility, they may be covered with the private insurance. So before going for any specific treatment or any tests which are not covered by government, make sure to check with your private insurance company whether that is covered. And one good thing with private insurance is most of the medicines are free. Also, dental is covered with private insurance, which is a big help because dental is very costly here. But it depends on your provider whether how much percentage is covered. So you first need to make sure to check with your service provider, to check with your insurance provider whether how much percentage is covered with them, because rest of it you have to pay from your pocket. Many extra services are also covered with private insurance like physiotherapies, massages, laser therapy, contact lenses or specs every year or 2 years. Sometimes you have to pay from your pocket first for the medicines or for any tests, and later you can claim with your private insurance company. So make sure you are keeping all the receipts with you. Also, make sure that any medicines or tests which are not covered by government are prescribed from your family doctor so that it is easy to get the reimbursement. Yes, one more thing which you can do is if you and your spouse both are working, then you can get the medical insurance, private medical insurance from your and your spouse's company as well. So in case any specific tests or any specific medicines which are not covered in your insurance, it may be covered with their insurance. And the private insurance which is provided by the company, you don't have to pay a huge amount every month from your salary. So it is always good to have that. There are some over-the-counter medicines which may not be covered in the insurance, so you have to pay for them. And on the top of that, most important thing is, even if these things are covered in your private insurance, still try to save some amount separately from your salary every month for emergency, because you never know if any of the emergency can come and you have to pay the amount from your pocket. If that is not covered or you don't have a job that time, you should save some amount for the unforeseen circumstances. That's all for today. Hope it clears your doubts related to the medical system in Canada. It is overall good, but only thing is it takes a lot of time to get the treatment sometime, which becomes frustrating. Thank you so much for watching. See you in the next one. Bye.